We're here today with Dr Kasen Somana, who's a cosmetic dental surgeon at Signature Dentistry in Toorak. And Dr Somana is presenting today on an integrated approach between aesthetic medicine and forming the connection between aesthetic medicine and cosmetic dentistry. So thank you so much for taking the time to talk to us today. So I just wanted to have a question. So you're an advocate for the importance of an integrated approach to aesthetic medicine and the inclusion of cosmetic dentistry in that, which is a new approach for Australia. As the different areas of aesthetic enhancements like plastic surgery, non-surgical and the like are starting to become more integrated, do you think, I know you do, that cosmetic dentistry is still not being included as it should when it comes to an all-inclusive approach?
Yeah, it's on the sidelines and it really needs to come to the forefront. You know, we look at all the statistics out there and the sociological studies, and that's what we're presenting today, that you know, from an appearance point of view, the most striking feature that people remember is your smile. It's not the fact that you've got wrinkles or your hair is a different colour, it's your smile, followed by your eyes. So it has to be part of that integral approach, and it has to be included in any sort of makeover. But it also allows for not over-treatment, but keeping minimal treatment for both dentistry and injectables and non-injectables, or surgical and non-surgical approaches to aesthetic medicine.
Yeah, I totally agree with you, because even if you look at someone, it's the first thing that you notice is their smile. If someone's got bad teeth, no amount of injectables is going to fix. And sometimes they might not be like bad teeth, but there might be little things that you can do to actually make them, the whole face look a whole lot better.
Yes. Yeah. And that's the key thing, is that we've seen some older patients, or even semi-young patients and sort of middle-aged, that have had a lot of work done on them. But when they smile, the smile gives it all up. So they may be looking like they're 30, but they've got the teeth of the 50-year-old, and it just doesn't work.
Yeah.
So we need to sort of get that together, so it all looks quite natural and aesthetic.
Yeah, absolutely, I agree. So what's your vision for the how it's going to combine together, how it would work?
Look, my vision for the whole thing, and what I hope for, is that at the end of the day, we're all clinicians. We all chose this profession in the healthcare to benefit our patients' lives. We are living longer, we're working longer, so we need to enjoy as much as we can the standard of living and quality of life along the way. So what we want to do is try and look at minimal intervention where needed, or early intervention, and keeping all treatments to the minimum but getting the maximum result. That way, as life goes on, we can just tweak and fine-tune things. So you're still looking good, aging naturally, but looking the best you can all through that.
Fantastic. Well, my mother used to always say to me, you know, keep your teeth amazing, brush them twice a day, because they're the only ones you're going to get, and you've got to look after them. And it's true. I know that if your teeth feel and look good, even when you've been to the dentist, you feel good all over. So it's the same thing. It's
in fact, one of the slides in the talk that we're giving today is that just what does a smile, what is it perceived as? And it's perceived that you're healthier, you're more intelligent, you have a higher social status, you are happier, as well as that, you know, they're even saying that some studies show that you will have a better chance of getting a job.
Yeah, wow.
Yeah, so there's all these positives that come with it.
Yeah, no, I totally agree. Oh, that's great. Well, thank you so much for taking the time to talk to us. And we'll be putting out some more blogs on cosmetic dentistry, which is a new section we've just introduced on Plastic Surgery Hub. So if you've got any questions, just drop us an email at info@plasticsurgeryhub.com.au. And if you're in the Victoria area, here's your man from Signature Dentistry in Toorak. Thanks very much.
My pleasure.
Thank you.